Hello, this is Dr. Gay from First Look MRI, and this is a 55-year-old male who was injured on his motorcycle about 3 weeks ago. He complains of knee pain, most pronounced medially, and he has a grade 3 tear, the highest grade injury of his medial collateral ligament. So it's just a nice example that shows the MCL or medial collateral ligament over on the medial side of the knee. These are two images, both looking in the same orientation, called coronal images, where we see the femur up top, the tibia down below. We have the medial or inner side of the knee and the lateral or outer side of the knee over here. This one has bright fatty marrow and bright subcutaneous fat called a T1 view, and this view has fat suppression. So all the fat in the marrow space and subcutaneous fat is dark, and the fluid really stands out as white on this one. So we see here some fluid along the medial knee, and we see the fluid undercutting and outlining the medial collateral ligament. So this is a component of the medial collateral ligament. These are the thick outer fibers. We see them attached to the femur up top good. It comes down here, a nice thick MCL, but the distal attachment to the tibia is completely torn, and it's flipped inside here, and this is the free end right here. This should come down and attach over here. So this is a grade 3 or complete tear of the medial collateral ligament. And again, the thick outer fibers are normally attached to the femur, but completely torn and flipped upon themselves here. So this is not going to heal. Oftentimes MCL tears, even grade 3 tears, can heal spontaneously, but in this case where this is looped inwards and flipped upon itself, this will probably not be able to heal, and so the surgeon has to be alerted to this. Now the MCL has the thick outer fibers here. It also has a thin component. It's very hard to see, but it hugs the outer surface of this meniscus, this black wedge, and the proximal fibers are torn up here from the femoral side. So this is the deep fibers of the medial collateral ligament, and we see it's torn from the femoral attachment. So the thick outer fibers are torn from the tibia, and the thinner capsular fibers are torn from the femoral side. So this is a grade 3 tear. You may also note that this little triangle here, the medial meniscus body, is not in the normal position between these bones. It's squirted outwards. We call this pseudo-extruded. And we see the pseudo-extrusion, we think about maybe it is torn, especially towards the back. So this is a very common tear. I have arrows here pointing to the area. This is the meniscus root where it attaches to bone, and this is the posterior horn. And often patients will get a tear of their root or posterior horn or where they attach in this area, and then it loses the normal hoop stress, and it allows for the meniscus to just float outwards like this. It's not attached. So they have a tear of the posterior horn and root, allowing for pseudo-extrusion, and again, this complex grade 3 tear of the medial collateral ligament.